Hello everyone, welcome to FMT Guru. We are going to discuss NEET PG 2021 FMT recall questions along with 35 to 40 image based questions and also some updates from KSN Reddy 35th edition. Yes, this is one very commonly asked question in your entrance examination. Active principle in the poisonous seed shown in the image. Options are Abrin, resin, cannabinol, bilavenol. The picture here, you can see the red color seeds. We can see red and black color seeds. Red and black color seeds. So whenever question asked, the image asked red black color seed, it must be rati seed, that is Abrus precatorius seeds. So answer for this question is Abrin. So according to KSN Reddy 35th edition, page number 421, chapter 29. So this topic is very commonly asked. So let me discuss all the important images asked in the exam. So we are going to discuss plant organic irritants. So very commonly asked in exam. Plant organic irritants. Plant organic irritant. So they are organic in origin and irritants. Okay. You can see there are 5 important pictures. All 5 are very commonly asked in exam. Please concentrate. The picture number 1. So you can see here the seeds are shiny. Seeds are shiny and seeds are having dark and white markings. Dark and white markings. Or you can see these seeds, shiny seeds are known as seeds of castor. Please remember the scientific name Ricinus communis. So what is this? Ricinus communis, also known as castor seed. The fatal dose is 2 mg per kg body weight, 3 to 4 days, and the fatal period is around 3 to 4 days, and the fatal dosage is 5 to 10 seeds. Remember, it causes hemorrhages in the multiple organs, which causes death in 3 to 4 days. It inhibits RNA polymerase enzyme. It inhibits protein synthesis. One very famous case is umbrella murder case, that is related to Ricinus communis. The second seed, you can see here there is a color, that is a black and red color. Whenever you see this kind of picture in exam, it must be Abrus precatorius. So also known as Gunchi, rati seed, Indian licorice. The fatal dose is 1 to 2 seeds and 3 to 5 days. Okay, yes. I'll discuss only the images. Yes, now third one you can see here non-shiny seeds. Non-shiny seeds which are dark brown and they are having longitudinal lines over the surface. So this must be Jamalgota seeds or Croton tiglium seeds. The fatal dosage almost same, 4 to 5 seeds, 1 to 3 days. Then we can see the fourth image there. You can see the heart shaped black color seeds are there. Whenever you see heart shaped black color seeds, projection at one end, it must be Semicarpus anacardium seed, also known as marking nut. Fatal dosage 5 to 10 gram, 12 to 24 hours. It is used in artificial brews. Then you can see the one more plant organic irritant. So nothing but the capsicum annum. So this is the capsicum annum. Capsicum annum. Okay, and remember it causes one very famous condition, very commonly asked in exam, Hunan hand. Hunan hand. If question asked in exam, Hunan hand is caused by capsicum annum. Then one more here, you can see here. So this is Calotropis procera. Calotropis procera is used in artificial bruise and in abortion and also in the infanticide. So this is capsicum annum. And one more picture, very commonly asked. This picture, what it is, can you identify? What is this? This is also comes under the plant organic irritant. So this must be that is ergot. Ergot is the correct answer. As you know, all of you, ergot is because of ergotoxin and other compounds. That is basically the fungus. The claviceps is the fungus that leads to this ergotism. So, and it is associated with bro, then very famous mnemonic bro, barley, rye and oat and wheat. So claviceps, that fungus that leads to production of the ergot, which causes Saint Anthony fire. Okay, Anthony fire, if the question asked in upcoming exam, your answer should be ergot. So there are 7 important organic irritants. If shiny seeds are given, Ricinus communis. Black and red color, Abrus precatorius. If it is black colored heart shaped, marking nut. Dark brown with longitudinal lines, non-shiny, Jamal gota. The plant with a white color flower, Calotropis procera. If the plant is given along with the purple color flower, a pink color flower, it must be Calotropis gigantea. Capsicum annum causes Hunan hand, and ergot, so that is because of the fungus claviceps, and that is because of the growth of the fungus in the bro, that is a barley, oat, rye and wheat, which causes Anthony fire, that is the burning sensation in the feet. So briefly about this. Second question asked about identify the mechanical injury in the image. Options are incised wound, inside looking lacerated wound, hesitation cut of suicide attempt, lacerated looking incised wound. So lacerated looking inside wound, no, not the answer. Laceration looking incised wound, that is seen in scrotum, that is seen in axilla, that is seen over the neck. Okay, so this is not the answer. Hesitation cuts are seen in case of, so over the forearm commonly, so where you will see multiple incised wound. So here you can see it is irregular. You can see here this has a irregular margin, which has a irregular margin. You can see the margins are irregular. So margins are irregular, and there is a presence of bridging of tissues. So there is a presence of bridging of tissues. Bridging tissues. Bridging tissues are there. Irregular margin is there. Surrounding area you can see the bruise. Surrounding area you can see the bruise, and it is seen over the bony prominence. So all this go in favor of incised looking lacerated wound. That is the correct answer. Answer for this question is B, that is incised looking lacerated wound is a type of laceration commonly seen over the bony prominences, characterized by bridging of the tissues, bruise in the surrounding area commonly seen over the bony prominences. So what are the types of laceration? Let me just revise all the types of laceration in 1 minute. Yes. So this is the first one. You can see the blunt perpendicular impact. That is because of crushing between the two hard objects. This is nothing but that is split laceration. So this is split laceration. Very simple. It is already we discussed. What are the common sites? Scalp, eyebrow, cheekbones, lower jaw, iliac crest, perineum and the shin. Perineum and the shin. So this is very commonly asked. This is also known as inside looking laceration. Next, look at this second one, where there is a tangential impact is there, and this is known as stretch laceration. Stretch laceration. So this is known as stretch laceration. Third one we can see there is a characteristic finding, flaying. Whenever you see flaying, so then horizontal crushing impact, it must be a shearing force, it must be an avulsion laceration. This is avulsed laceration. Avulsed laceration. What is a very important finding? The very important finding will be flaying. Flaying. Okay. And the fourth type, irregularly directed impact. So that should be a case of tear laceration. Okay, and this is the tear laceration. And the last one, heavy, relatively sharp-edged instrument like axe that causes cut laceration. Cut laceration. So there are 5 types of laceration: split laceration, stretch laceration, and third one owl's laceration, fourth one that is a tear laceration, lastly the cut laceration. Yes. Now question number 3. During autopsy, doctor notices finding as shown in the image. Which is true regarding the finding? It is due to sulf-hemoglobin pigment. This change is seen at 48 hours. It is due to vascular disease. It is associated with lightning case. Definitely it is not lightning case. In lightning, we normally see filigree bone. We will see filigree bone. The filigree bone is also known as arborescent markings. Okay, filigree bone, arborescent markings, all these are seen in case of lightning. So it is not the case of lightning. Due to vascular disease, no. This change is seen at 48 hours, no. So this is a case of putrefaction. So this is a finding that we can see here, that is the putrefaction. Putrefaction, we can see the green color pigment. You can see the green color discoloration. So you can see the green color discoloration. So this must be green color discoloration of the putrefaction. That is because of sulf-hemoglobin. So answer for this question is sulf-hemoglobin, that is caused by the putrefaction Clostridium welchii bacteria. We discussed many times in our classes. Okay, what are the findings in putrefaction? We will go fast in 1 minute. You can see here a case of putrefaction. You can see the blisters are there. There is a black color discoloration is there. So let's see what are the important MCQs can be asked. In external putrefaction, so the first site is the abdomen. The first site will be, that is right iliac fossa. You can see here right iliac fossa, nothing but ileocecal junction. So at ileocecal junction, Clostridium welchii, which is the well-known gas gangrene forming bacteria that causes greenish color discoloration. Then comes is the chest, next is the face, neck, lower limbs, upper limbs. It is the external putrefaction. So the first external sign will be greenish discoloration over the right iliac fossa. The first internal sign, your answer should be greenish discoloration, that is under the surface of the liver. Green color. Why there is a green color? Because of sulf-hemoglobin or sulf-met hemoglobin. Black color, yes, there can be black color because of ferric sulfide. Optimum temperature for putrefaction is 21 to 38. It occurs in 12 to 18 hours in summer. In winter, it is around 1 to 2 days. So this is external putrefaction. So the student normally get confusion in internal putrefaction. So before that, there is one more very commonly asked. You can see here, this is the classical finding in case of putrefaction. Remember, in putrefaction, where we can see the veins, visible veins over the chest and also in the upper limbs or in the lower limbs. So this is known as marbling. So marbling is the correct answer. So it is the greenish brown, purplish red discoloration of superficial veins at the root of the limbs or thighs, sides of the abdomen, shoulder, chest and the neck. This is marbling. When it is seen that is within 24 hours. Become very prominent in 36 to 48 hours. It becomes black up in 3 to 4 days according to K.S.N. Reddy, that is 35th edition. Now this is the area where student usually get confusion. Internal putrefaction. Internal putrefaction, nothing but that is liquefaction of the tissues. What is the first organ which shows this? Your answer should be that is larynx and trachea. So it occurs in 5 to 10 days. The first organ will be larynx and trachea. Larynx and trachea. Then stomach, intestine, pancreas, spleen, liver, lungs, brain, heart, kidney, bladder, lastly the prostate or non-gravid uterus. It can be asked in your upcoming exam. Prostate or non-gravid uterus. skin, muscle tendons, teeth, bones. Okay, the last organ will be teeth and the bones, or it is that is prostate and uterus, skin, muscle, tendons are the other organs. Let's see. So in larynx and trachea, it occurs in 24 to 36 hours in summer, 2 to 3 days in the winter. And you can see here, this is the putrefaction of the liver, so which is known as honeycomb liver. You can see the gas bubbles. You can see the gas bubbles that is coming out. So that is because of the Clostridium welchii and other bacteria. So this is known as the honeycomb liver, very commonly as, okay, Swiss cheese appearance of the liver, that is seen in case of putrefaction. Next one more point about the putrefaction is about the maggots. So maggots, remember, so they are larvae of the flies. So larvae, so you can see the adult fly which lays eggs in 8 to 12 hours, then larvae that forms in 2 to 3 days. So, and whenever the question asked, when maggots are seen, it must be 2 to 3 days or 3 to 4 days. When adult flies are coming out, your answer should be that is around 7 to 10 days or 10 to 12 days. Then fourth question, a dead body was recovered from near a pond by police. During autopsy, probably a case of drowning. During autopsy, the finding as shown was noticed by the autopsy doctor. This is suggestive of which of the following case? So very simple, very simple it is. Whenever you see sodden appearance, whenever you see bleached appearance, whenever you see bleached sodden appearance, this must be a case of immersion in water, nothing but washerwoman hand. It is a washerwoman hand. Your answer should be washerwoman hand, that is seen, that is 36 hours. Let's see. So what are the important findings in drowning? So drowning is very commonly asked in exam. We discussed many times. Let's see only the image based questions. So the first one, you can see here drowning. You can see the fine leathery froth. So fine leathery froth. Remember, fine leathery froth is a non-specific finding. It can be seen in various conditions. What are the various conditions? It can be electrocution, epilepsy, opium poison, pulmonary edema, putrefaction, strangulation also. And the second finding is the question asked in exam, bleached, sodden, wrinkled appearance. That is nothing but washerwoman hand. And remember, so it is because of water imbibition in the epidermis. Water imbibition in the epidermis. So it's seen in entire hand in 24 hours. Okay, so this is the second important finding in the drowning. Let's see the third important finding. Third important finding is very commonly asked. Whenever you see weights firmly grasped in the hand, so that shows struggle of the person. We see the surest sign of drowning. So this is nothing but cadaveric spasm. So okay, cadaveric spasm. It is the cadaveric spasm. If they ask you in exam, what is the surest sign of the drowning? Your answer should be cadaveric spasm, that a weights firmly grasps in the hand. Okay, yes. The fourth one. So the question very commonly asked, you can see a dilated lung here, dilated lung, and we can see the rib markings. Whenever you see rib markings, whenever the question is given with some blood tinged froth is given, so foamy lung with excessive froth, less water, there is a more and more froth. Froth is nothing but surfactant and along with the mucus. Less water due to breathing effort. Whenever you see rib markings, blood tinged froth, and also break in the alveoli. You can see the alveoli here, alveoli, and there is a break in the alveoli. So this must be a condition known as emphysema aquosum. So this is known as emphysema aquosum. So this is the feature of conscious drowning. So once again, I'll repeat all the four important images. The first one is the fine leathery froth, bleached sodden appearance, wrinkled appearance known as washerwoman hand. Third one is the very important feature known as cadaveric spasm, and the fourth one is emphysema aquosum. So that is a feature of conscious drowning. This is about the question number 4. Question number 5. During evidence recording in courtroom, the lawyer asked the witness, "Were you there when A killed B?" It is a leading question. Witness answered yes. So leading questions can be asked in. Remember, leading question can be asked only during cross-examination. Let's see some important MCQs about the recording of evidence. Recording of evidence in a court of law. The first step will be the oath. The oath comes under 51 IPC. But remember, this is not required in child less than 12 years. And it is punishable. So, the refusal to take oath is punishable under 178 IPC Indian Penal Code, 6 months and a fine, that is. That is the first. Second, examination in chief. It is also known as direct examination. Comes under section 137, where leading questions are not allowed. But leading question can be allowed when the judge is satisfied that the witness is hostile. Okay, hostile witness, also known as U-turn witness. What do you mean by leading question? Yes or no type of question. Cross-examination. Cross-examination comes under, that is 141 to 146 Indian Evidence Act, where leading question can be asked. It is usually by defense lawyer. There is no time limit. Re-examination again by the public prosecutor. The Indian Evidence Act is 137, 138. Lastly, question by the judge or the court can ask at any time during the proceedings. So these are all very commonly asked. Perjury defined under 191, punishable under 193. Giving false certificate under 197 IPC. All these are very commonly asked. So please go through 191, 193 and 197. The very commonly asked in your exam. Let's see now. Sixth question. A 30-year-old male presents with the history of consumption of some unknown substance. So unknown substance. The attending doctor notices the person to be having diaphoresis. He is having diaphoresis, sweating, headache, and also acute coronary spasm. So this must be a case of some poison. So and the person is least likely to show which clinical feature. I think so. Here all the signs and symptoms suggestive of cocaine poison. Okay, cocaine. So yes. So hypertension, hypothermia, that is seen. Yes, that is seen. That is not the answer. Yes, dilated pupil also seen. Tingling, numbness sensation, that is also seen. Yes, not the answer. Tachycardia, tremors, hallucination, feeling well-being, all these are seen. So in case of cocaine poison, bradycardia is not seen. Your answer should be D is the correct answer. So cocaine, asked in NEET PG 2020, 21 and many of the exams. Let's discuss about cocaine in 1 minute. Okay, cocaine. So cocaine, so the smokable form is known as crack. Okay, smokable form. You can see here, crack. The crack means that is smokable form of the cocaine. What are the clinical features? Dilated pupil. Pupils are dilated. So sympathetic overactivity. Nose bleeds may be because of hypertension. Nasal decongestion. Sniffing rhinorrhea. Tachycardia, not bradycardia, tachycardia. Impaired movement. Seizures. Elevated blood pressure, respiration, temperature. Hallucinations, agitations, anorexia, weight loss, all these are seen in case of cocaine as a clinical features. Let's discuss about some important points about the cocaine. Cocaine is also known as crack and snow. The fatal dose is around 1 gram and it is from a plant known as Erythroxylon coca and prevents the reuptake of norepinephrine. So it prevents the reuptake of norepinephrine from the neurons. So there is a excessive levels of norepinephrine that leads to hypertension, all these clinical features. And this method is known as snorting, One we can see here on the right side, snorting and skin popping. They are common two methods of cocaine intake, snorting and skin popping. Aphrodisiac, so it is a well-known aphrodisiac, and there is a stage of excitement and stage of depression, and amyl nitrate is used as a treatment part. Okay, amyl nitrate is used in treatment of, your answer should be cocaine. Let's see some more important points. So this is the very commonly asked question, asked almost 5 times in recent exam. You can see the person who is suffering from chronic cocaine poisoning, so he is having tactile hallucination. So these tactile hallucinations known as formication, or we can see Magnan symptom, are cocaine bugs. What will be the clinical finding? Irregular scratches and the ulcers. Very commonly asked in exam. Now 7th question. A person was sitting naked in balcony of his house, facing crowded park and getting sexual gratification. This paraphilia is known as, so this is very simple, this is showing genitals, so that is exhibitionism. Your answer should be, this is exhibitionism. Let's discuss about all the 4 options. The first one is a masochism. So this is the classical masochism. Masochism is opposite to sadism, so where sexual pleasure by taking pain. So you can see here, masochism is known as passive algolegnia, suffering pain. So okay, and it is sometimes it occurs along with the sadism, so that is known as bondage. Bondage is equal to masochism and sadism. Sometimes it is associated with autoerotic death, that is in case of hanging or strangulation. Okay, the very famous writer Masoch, so he used to get stimulus to write the book, so being whipped by his wife. And we can see here, this is known as the exhibitionism. Exhibitionism includes 3: mooning, flashing, streaking. It is punishable under 294 IPC. Remember, 294 IPC. And other options, C option, that is nothing but the petechism. So petechism is inanimate object, compulsive need for sexual gratification, maybe dress, handkerchief, bra, petticoat. So this is first given by the Alfred Binet. Okay, this is known as petechism. And one more, that is andinism, that is also known as urolagnia, urophilia, sexual gratification by sight or odor of the urine. It is also known as golden shower. Remember, uranism means fingering, licking or fondling. Yes. Question number 8. A child while playing plucked a fruit from a tree or plant, consumed it. There is unknown substance is there. What are the clinical features? Restlessness, painful swallowing, photophobia, not able to pass urine, dry hot skin. Which of the following is true regarding diagnosis and antidote? Remember, this is a very simple question. So this must be a deliriant poison, that is a datura poison. In datura poison, we use physostigmine. So answer is A, physostigmine. So pralidoxime, no. Oleander is a cardiac poison, that is not you. That is not the, so all these are not, do not occur in case of oleander poison. So your answer should be datura and physostigmine. Let's discuss about datura briefly, 1 minute. Datura is a deliriant. What is the fatal dosage? 1 gram. What is the fatal dosage? 100 to 125 seeds. Fatal period 24 hours. 90 manifestations. Very simple. Dysphagia, dysarthria, dilatation of blood vessels, diplopia, dry hot skin, drunken gauge, delirium. The delirium is muttering delirium. There is one very important finding known as carpologia. Carpologia can be asked in exam. Drowsiness, dryness of the mouth, and treatment is gastric levers, physostigmine and pilocarpine. Remember, physostigmine is given because it can cross blood-brain barrier. So it is physostigmine is better than the other agents, that is neostigmine. And one more very important point, remember, it is a well-known road poison. It is used in robbery. And what is the active principle? It contains hyoscine, hyoscyamine and traces of atropine. So it is nothing but an atropine poison. All the signs and symptoms in line with the atropine. Treatment is physostigmine. And one more image based question asked is, so this is datura seed. So this is datura seed and this is capsicum seed. So capsicum seed, capsicum seeds. So remember, datura seeds are double-edged, capsicum seeds are single-edged. So datura seeds are somewhat kidney shaped and they are brown in color. So but in capsicum seeds they are yellow in color, they are usually round. So datura seeds are mixed with the capsicum. So that these two images you must know. Next, and remember, this is carpologia. This is known as carpologia. Carpologia, very commonly asked. And the datura is a well-known road poison. Road poison. Yes. So, okay. Question number 9. A daily wage laborer who was working in the field in hot weather. So, it must be some heat stroke. Collapses with the loss of consciousness. The patient was brought to hospital. Attending doctor measured his body temperature to be about 41.5 degrees Celsius. Which of the following least likely occur? Least likely occur. Remember, in heat stroke, sweating is absent. It is a repeat question. Answer should be sweating. There can be hypotension. There can be throbbing headache. There can be tachycardia, delirium and psychosis also. Hot, dry, red skin also seen. But sweating is absent in case of heat stroke. That is a well-known repeat. So, well-known repeat. You can see here heat stroke, throbbing headache is seen, no sweating, rapid strong pulse, nausea, vomiting, dry heart, red skin, may lose consciousness. So, yes, sweating is present in heat exhaustion. Yes, so this is about the heat stroke. A woman at term delivered twins. She alleges a male to be their father, which was denied by the father. On paternity testing, he was found to be the father of one child. This is suggestive of. So we can see here twins with two different fathers. So of same age, it must be superfecundation. Superfecundation, correct answer. Let's see what is superfecundation. Superfecundation is fertilization of ova, that is two ova, which have been discharged from the ovary at the same period by two separate acts of coitus committed at short interval. That is superfecundation. Let's see what is superfetation. Superfetation, fertilization of a second ovum in a woman who is already pregnant. Superfetation. Then one more option was there, posthumous. Whenever question asked about posthumous child is a child born after the death of its father, the mother being consumed by the said father. So that is known as posthumous child. Child born after the death of the father. Then supposititious child. It is also known as fictitious children. A woman pretend the pregnancy and the delivery, later produce a living child, male or female child, as her own, or she may substitute a child for an abortion. So this is known as fictitious children. So all the four options are very commonly asked question. So the answer for this question is superfecundation. Superfetation, already discussed. Posthumous, after death of the father. Supposititious is nothing but the fictitious children. And the last question. A 50-year-old male suddenly stopped alcohol consumption 3 days. So that means 72 hours. Presents with the autonomic instability, disorientation, hallucination and agitation. So this must be DT, a condition of delirium tremens. Delirium tremens is the correct answer. Let's see what is delirium tremens, what is Korsakoff psychosis, Wernicke encephalopathy. So alcohol withdrawal syndrome. So you can remember with the help of mnemonic hits. That is seen after 72 hours or up to 96 hours after the last drink. Hits, H for hallucination, I for increased activity of the vital signs, that increased vital signs and insomnia that is seen. T for that is tachycardia and the tremor that is seen. S for sweating, seizure and stomach pain. So that is nothing but the nausea, vomiting. And in case of delirium tremens, there can be suicidal tendencies. Mortality is seen up to 30%. So yes, this is a case of delirium tremens. The mnemonic is HITS. Let's see what is Wernicke encephalopathy. Wernicke encephalopathy is because of the vitamin B1 deficiency. The symptoms can be remembered with the help of mnemonic known as GOA. You can see here there is a ataxia, gait ataxia, O for ophthalmoplegia, and A for there is a altered sensorium. So GOA is a mnemonic for the Wernicke encephalopathy. Let's see some more important point. So chronic alcoholism. See here a chronic alcoholism. So there will be thiamine deficiency. Thiamine deficiency will cause brain tissue ischemia plus cell death. That leads to Wernicke encephalopathy, that is characterized by GOA we discussed. What is Korsakoff psychosis? Korsakoff psychosis characterized by one is amnesia, confabulation and the psychosis. So this completes the 11 question along with some 34 to 40 images and some important MCQs that can be asked in upcoming exam. Thank you. Happy reading.